Welcome to the next part of Hidden Parts of Healing. We're going to look at why when you have your gallbladder out, why that you may feel like your breath still is a challenge or you're just always fatigued all the time. In this series, we're looking at how common medical procedures impact or cause havoc in your body and how your muscles are able to work together. And it's just another layer of your healing. I'm Cara Lindell. I'm the founder of the Bridging Institute, and we look at how daily disruptors through your lifetime impact your ability to move. And we also then reset how your muscles work together, and so that you're feeling and moving better. This is Louise, and she's going to help with how we can explain and talk through what happened during your surgery and then with the recovery and the piece that's still yet to happen. So Louise, I'm going to let you lay down, and there's a pillow for you. And I'm going to prop up her legs so she's all comfy. And these are peanut balls. They're just nice and soft and bouncy, but they're really awesome tools for helping be able to discover how movement in our core is happening, but also to support it as well. So part of the gallbladder surgery, gallbladder is on your right side, just below your ribs, kind of in that space between the ribs and the pelvis, which sometimes people refer to as a hip bone. And when you have surgery, most common these days is the laparoscopic or minimally invasive. And so you've got probably a few different scars, 3 or 4, over in the middle of your body. Often belly button is one, and then a few others. So if you draw a dotted line from all of those little scars to approximately where your gallbladder was, you are tracing the path of where they had tubes and then instruments going inside your whole abdominal cavity to get that gallbladder out. So with Louise, we're going to just talk through kind of what the parts of the surgery are and why they impact you and why it might be still bothering your breathing, and perhaps a couple of other things. So just a quick lesson, the muscle that is in the middle right here that we use to breathe is called the diaphragm. And it connects to every single one of our ribs. It is adjacent to or just above where the path to that gallbladder is. And often one of the little cuts that they have for the procedure is fairly close to the diaphragm. So what we'll find is that the tubes that they insert, sometimes it's just irritation from that whole area being aggravated, or maybe something just actually nicked or abrased the diaphragm muscle itself. But we'll often find that that muscle on the right-hand side is not really working, pushing out and back the way that it should, because it should just, we breathe in, it pushes down, and then come up. So another part of these minimally invasive surgeries, which we talked about with the appendix removal, is that the very first part is that the whole abdomen is expanded with gas so that there's room to get these tubes and the instruments in. And the whole disruption of all that extra space and between all the different layers is part of what causes you some discomfort later, because as it all collapses down, it doesn't necessarily go back together in the same way it was working before. So what we'll find is if I use the smaller peanut and I just hold it kind of at the base of her ribs, which are right about here, she still has her gallbladder and has not had this surgery, but just want to talk through some of the typical things we'll find. So if I just lightly hold, I'm not even really pushing down much. Do you feel much pressure there at all? No. Okay. But if I just lightly hold, I want to feel the motion, and it's pushing down toward her feet with her breathing, and I clearly feel that. If you had your gallbladder out, you may not feel that. but you can just hold your hand or hold a washcloth to simulate what I'm doing here. So often what we'll find is that the right side of the core is just really tight and not moving. And one way you can check for that, I'm using this big peanut ball, but you can use a towel or again, a folded up washcloth. And I'm just lightly supporting this on top and just seeing with very easy motion forward and back. Does it go to one side? Does it move to the other? Louise is very centered. Again, she did not have her gallbladder out. What you're often going to find is the movement follows the direction of the from the middle to where the gallbladder, so from center to the right. And you can just kind of hold it and let all of the tension in there just melt. This is not something we would do in the first 6 or 8 weeks after the surgery. That is too soon. It is healing inside. But then just getting motion restored in the core is a huge part of helping that recovery, so that you feel back to normal and that your breathing is back to normal. But then we also want to make sure that the legs work with the core, that they have this nice, easy rotating and rolling motion, and that both of them match. Often I would expect that the right one may feel a little heavier and a little harder to move, because most of the impact of the surgery was to the right side of her body. So just a quick recap, there's a few parts to why you may not be breathing and feeling quite right after the gallbladder. It's because one is they distended your belly and everything inside just isn't back to working together, all the muscles, as well as they should. Two, the proximity of where the access for the tubes and the instrumentation relative to your diaphragm, it at least causes often irritation, and the diaphragm muscle, when it's irritated and doesn't move so easily, just tightens up everything on your whole right side. And then the third part is, once this is working better, it needs to interconnect back to the other parts of your body so that as a whole system, they can move more easily. So that is often what happens as an after effect when you've had a gallbladder removed. The next in our series is going to be, kind of keeping this theme of the abdomen, is why does a C-section impact so much? So see you there.